Hello, everyone, and thanks for joining me today. My name is Adepeju Adeobaseki, and the topic we'll be discussing today is evidence-based practice for infection control measures in acute hemodialysis patients with catheter. Our objectives for this course include being able to describe factors associated with lessening the risk of central line associated bloodstream infection, aka CLABSI, in hemodialysis patients in the acute setting. Also, being able to describe the negative implication, and we're also going to discuss the best practices for CVC care based on evidence based practice while also reviewing some of the literature and also consideration for licensed nurses caring for dialysis patients. And we're also going to promote practices that decrease the incidence of infection in dialysis patients with CVCs. Please note as we proceed that I will be using the word CVC and catheter interchangeably throughout the rest of this course. So, the purpose of this presentation is to help the practicing nurses to apply knowledge to their direct care of patients with hemodialysis CVCs in the acute setting, ultimately to help decrease the CLABSI occurrences in dialysis patients and promote the patient care experience. So let's talk about CLABSI in hemodialysis patients. The Center for Disease Control and Prevention states that hemodialysis patients using CVCs are 7 times more likely at risk for bacteremia when compared to hemodialysis patients just using the arteriovenous fistulas. Catheter use for dialysis is most common cause of bacteremia in dialysis patients. Evidence also suggests that CLABSIs can be preventable when the guidelines are properly followed. We're also going to discuss the 2 major routes for catheter contaminations in dialysis patients. The most common route is the migration of skin organisms at the site into the cutaneous catheter tract along the surface of the catheter with colonization at the catheter tip. The second most common is the direct contamination of the catheter or the catheter up by contact with hands or contaminated fluids or devices. So let's discuss the implications of CLABSI in dialysis patients. CLABSI has been associated with increased morbidity, mortality, and increased healthcare costs. Needless to say that CVC infection negatively impacts the hemodialysis patient's quality of life. Evidence-based practice on infection prevention. It is recommended that chlorhexidine impregnated dressings with a FDA-cleared label that specifies a clinical indication for reducing CLABSI are used to protect the insertion site of the short-term and non-tunneled CVC catheters. And this was recommended by the CDC in 2011 for their guidelines. And this guideline was also revised in 2017, and it has been updated. However, it is still recommending the same thing. So, needless to say that this recommendation is been effective and continues to be effective when followed. Some other literature review on infection prevention. Goddard et al. In 2013 and McCann et al. Suggest that the use of the CHG solution as a CVC site prep lessens the risk of CVC-related infection in hemodialysis patients. Furthermore, McCann et al. 2016 study concluded that there was no significant difference in the use of 2% CHG in alcohol with routinely used CHG solutions for catheter site prep antisepsis when compared to routinely used CHG solutions to reduce the CVC related infections. What they are suggesting in this conclusion is that as long as the CHD is present, that is the most important thing when prepping for CVC related catheter site. Nursing considerations when caring for hemodialysis patients with catheter. The number one most important thing is always effective hand hygiene, and also making sure that the proper PPE is used as indicated before or after the palpations of the catheter site area. Also, assess that the catheter dressing is intact. Check if there is dampness, looseness, or if it's visibly soiled. Continue to assess the date for the CVC transparent dressing to ensure it is less than 7 days, and also assess the date on the CVC dressing with the gauze to ensure it is less than 2 days. Assess to ensure that the HD CVC orbs are always covered. Please inform the right personnel to cover this up as soon as possible. Also observe that the dialysis nurse practice aseptic technique during the initiation and termination of hemodialysis treatment. For the intervention, aseptic technique is a necessity with any HD CVC related care. Scrub HD CVC pots or orbs with appropriate antiseptic and access only with sterile devices. Suction HD patients with tracheostomies regularly as appropriate to avoid sputum spills into the CVC dressing. Chloroxidine bathing is an additional measure to reduce the infection. Do not submerge the HD catheter in water. Use waterproof materials to cover the HD CVC port for patients that want to take a shower. Communication, communication, communication. Applying bedside report checklist will enhance communication between the hemodialysis team and the primary care team. Encourage patients also to report any catheter site discomfort to the staff as soon as possible. Also document and discuss the incision dates of the HDCVC. A tunnel cuff catheter is preferred to a non-cuffed catheter even in the acute setting if it's expected to stay in place for over 3 weeks. Overall, improving the infection control measures in hemodialysis patients will decrease the length of hospital stays, mortality, and cost, also enhancing the handoff process between the primary care nurse and the hemodialysis nurse will foster a better patient experience and patient safety. Thank you for completing this course. Please be sure to complete the course survey from the link below. Thank you.